Hospital overwhelmed as virus cases spike in Eldoret. We were looking at the story earlier. It's in the Standard today, talking about revelations by a doctor that COVID-19 cases are increasing at the Moi Teaching and Referral Hospital, putting Eldoret in sharp focus. Even in the figures that were released yesterday by the Ministry of Health that track the number of COVID-19 cases on a daily basis, yesterday's cases had Uasin Gishu County having very high cases. In the last couple of weeks, we've seen a hospital in Nakuru level 5 also reporting a high number of people who are going to hospitals seeking specialized care, requiring oxygen and requiring some intensive treatment in those hospitals. The number of positivity cases also rising. Looking at the percentages now going to beyond 12%, just like CS Mutaikagwe said, look, a couple of weeks back when the measures were being relaxed, we were at 4.3%. Now we are going back to the double digits. Talk has been there, is this a second wave? Is this like a growing number of positive cases in the country? Are we witnessing more and more people testing positive? What exactly is happening? Is it a second wave or not? And we have to have that conversation today, and we are happily joined by an expert in this field, and this is virologist Dr. Moses Masika from the University of Nairobi. He speaks to us often on this particular subject. Good morning, Dr. Ari.
Good morning, Latif and CT Muga and Duoko. How are you?
Very well,
thank you.
I'm well too. Good, happy to join you.
Thank you.
Karibu sana. What do you make of today's proverb?
As usual, it makes me smile when CT Muga dishes out his proverbs. I need to see his references. I think it's quite a rich source. But yes, I think it's very true.
It is, right?
Yes.
Yeah, love makes everything
Flat.
It does. It does.
Even the wallet. So, Dr. Ari,
Especially the wallet.
we talking of flat, we thought at some point we were flattening this curve. And we were going to a level where, in number of infections were getting to manageable levels where we were getting below 5% as recommended by WHO. The government then took in measures. What's happening now?
As you said in your introduction, it's clear that we are in a second wave. The question is how big will this wave be, or how long will we ride it? So if you remember, we were at just about 4% when we began to relax some of the measures that were in place. And right now we are going as high as 3 times that, which means we have had a surge in the numbers of new cases. And if you look at another major difference now is previously it was Nairobi and Mombasa driving the outbreak of the pandemic. Right now you can see other towns that maybe just a tire or two below Nairobi, Kisii, Kisumu, Nakuru, Uasin Gishu, Kiambu, and what have you, including Kericho, that are having now a significant number of cases. And this is where the fear lies, that we shall have multiple nodes of outbreaks which will stretch our resources, and that may make the second wave much worse or much more difficult to deal with.
There have been questions, Dr. Ari. Are we, because it's a bit confusing where we are, where everybody's asking this question. First wave, second wave. Is it a second wave? Is it a completion of the first wave? Had the first one even ridden its own wave?
Matured.
Had it even gotten out? Was there adequate those are many questions. Was there adequate testing being done to even say that you had completed or that you had seen through the first wave? Where does this all come into play?
Yes, I think when you look at the information that we were receiving at the time, from the number of cases that were tested, you could see a steady decline in the number of positives from 11, 10% to 7 to 5 and to 4%, which indicated that we were winning, or we had managed to control the outbreak in a sense, not to defeat it. So Corona had not been completely obliterated from the country. It was still within us, and I think the hope was that even as we relax some of the measures, we would be able to keep things under control with the ones that are supposed to be in place, such as social distancing and masking, which have not quite been followed. But we also expected a resurgence, maybe not as quickly or as high as it has come, but with the relaxation of measures, this was bound to happen. So as I said now, if we recognize that, we can take measures to make sure we don't have a second wave. So I think indeed we had a first wave. We remember the measures that we took and how painful they were for many people, actually most people, and we seem to have underestimated the effect of those measures. Luckily for us, COVID-19 only requires basic control strategies. They seem basic, but they are very difficult to follow or to enforce. So because we felt that and we saw it work, I think some people may have taken that as a win of the war, which is not the case, and that is why we may be battling a second wave for a while.
Dr. How do we actually understand and explain this second wave? I mean, let me explain why I'm asking the question.
Yes.
Are we going to look at the numbers of people tested? Are we going to look at people who present themselves with these symptoms in hospital? And if so, what are these numbers? Now, when we talk of this second wave again, have we maintained the levels of testing and have they risen to a significant degree so that they can actually inform us as to the patterns of this disease, the possible infection rates, and all the other data that comes with it?
Yes, indeed, the testing could always be better, I think, in terms of numbers. But if you look at the thousands tested every day, 3,000, 4,000, 5,000, they still give us significant numbers to make or to draw conclusions or to make inferences. So if you look at the numbers that we were testing before, or say in September or thereabouts, even August, they may change slightly, but they are not very different from what we are testing today. What we are seeing that changes a lot is the positivity rate, or the number of cases that turn out to be positive out of each batch that is tested. And if you look at that number, it tells you a story that either you are getting more people infected or getting less people infected. The other bit that we're seeing is the number of people who are going into hospitalized care, being admitted either in regular wards or in ICUs. And this is clearly increasing right now, which means there are more people who are getting sick and more people also, and from that number, then we have more people getting admitted. And that is also an important number to look at, because if hospitals are flooded with sick people that they cannot take care of, then we'll begin to see more deaths. So I think in as much as we'd like to see more testing, more tracing of people who have come into contact with positives, the number of tests we are doing now are still useful in giving us a picture of what is happening.
Sure. If we're looking at a little bit into the science of it, Dr. Masika, and if now we're seeing more people who are presenting to hospital with these symptoms, and then after having taken a test is when they're found to be COVID positive, right?
Yes.
Against the previous that, which I guess still is the case, that still upwards of 90% of those tested positive are asymptomatic. What are the dangers of even those who are asymptomatic then mixing with the rest of the population? Because and if I can just go into that a little further, the argument that we've heard a lot is that it's okay, we're asymptomatic anyway, so there's no problem. So we have some people going into hospital, right? And if I don't have symptoms, then I'm okay. Can we diffuse that?
True. A lot of people, and we've confirmed that with our own data here, is that a lot of people with COVID-19 do not have symptoms. So when we begin to see the number of symptoms increasing, the number of people with symptoms increasing, it means the so-called hidden or the asymptomatic proportion is also equally increasing. So say if out of every 100 patients COVID, 10 or 15 present with symptoms, then it means if you are getting 30, you have 200. Or in terms of sick persons who are infected with COVID, many of them may not be showing symptoms. So in a sense, this is the tip of the iceberg. And if it becomes larger, then it shows that whatever is lying beneath it is much bigger than we can see. And it also underlines the fact that we cannot afford to drop our careful stance, our measures, especially social distancing and masking, because if we do, then we are exposing ourselves unknowingly, even to people who look healthy and may actually be infected, and also ourselves who could be infected and we do not know, we could be infecting others. So in as much as some of the measures were relaxed, in as much as we may not see people who are dropping dead on the streets, we shouldn't wait for it. We shouldn't look forward to it. We should actually assume, as we were doing before, that the next person could be infected and take measures to protect ourselves, and also that we could be infected, so we take measures to protect others. If I may put in something here, I was surprised we actually went ahead with the, the Mashujaa celebration in public, because this was an opportunity for us to give the public a very strong message that Corona is still alive, and we need to still make changes to keep it at bay. But when you do have such a celebration, you bring together very many people. I'm sure you've heard that Kisii business was booming of all manner of sorts. Right. So you bring together a lot of people from different backgrounds, and they must come together even though you are trying to ensure social distancing. And this is an opportunity for the virus to spread. But also for me, I think it was an opportunity to show Kenyans that Corona is alive. Let us stay at home as much as possible. Let us do what we must do, but if we make sure we are taking the safety precautions, especially social distancing and masking and hand washing that have been shown to work. I think so far what we've seen is that most Kenyans, the moment these measures were lifted, have also done away with the basic precautions that we should be taking.
Dr. Masika, last week we saw a report that came out that mentioned that children are super spreaders of infections generally. But then now, having looked into COVID-19, that children would be the super spreaders of COVID-19. Could you give a little bit of insight into that? And how does it exactly work? I mean, we know as parents, you send your kids back to school at the beginning of the term. By the time it's Friday, everybody comes with a runny nose. Why would they be super spreaders of this specifically?
I think several studies have actually shown that children are not the super spreaders that they've been thought to be, like has happened in many other cases of flu, where they become the conduit or the vehicle that takes flu to the older people. This time around, it seems that a lot of the infections are coming from adults. And it could be because of the current setting that in most places children are at home, and it's the parents who are going out there, and even though children play within the neighborhood most of the time, it's the parents or adults who bring the infection to them. So as it is now, I think the jury is still divided on that, but the current publications I've seen are saying that children are not, they could get sick, yes, they could get infected, yes, but they are not the main driver of infections in most places. As we open schools in many parts of the world, that could change, but I think in this situation, we've seen that COVID-19, so far, it is the adults that are playing a bigger role. The adults, meaning people who are not necessarily in school. It could also be the young adults, but even older ones who are doing different activities that are then transmitting whatever they get to whoever they come to contact with at home.
If you look at the way the testing is being conducted countrywide, Daktari, we had gotten to a point where there was a backlog of as far back as 10 days in terms of the results being released vis-a-vis the time the samples are taken. Has that improved?
I think so far there has been an improvement, but as always, we haven't really gotten on top of the need or the testing demand. This is because globally there is very high demand for the reagents, and locally we do not produce much. That means we have to rely on imports, and especially for the labs that use a certain form of testing that we call the automated testing. So I think although this demand, people have tried to catch up, it will keep staying ahead of us, especially if the number of cases are increasing. Because if you get 10 people today, you may end up tracing 100 or more. And the more people you trace, the more you need to test. The more cases you have, the more numbers you require to test. So I think we still have challenges in terms of testing as much as we should, but I think so far it's been manageable and it's been better than when we started. And I think the current situation is not that bad.
Dr. We've wondered aloud in the studio how it is that these
Yes.
countries that report massive testing, where do they get their test kits from?
Many of them manufacture, and also some of them will buy at what we call a very good deal. But I think the solution to this is local manufacturing, and local could be regional.
Are
so
we
that
capable
you
of
have-
manufacturing?
I think we can. It's what are we not capable of doing? I mean, city. If we,
I
if
agree.
we
I'm actually in
put-
agreement with you. I know we can,
Yes.
but the question I
Yes.
was going to ask next is, what is hindering
Not-
us from actually doing precisely that? Because we do have the capacity for manufacturing them.
Well, maybe the capacity currently may not be there or not sufficient, but also to get tests with level of accuracy, you need to have a history or experience making such materials. So we need to have invested in our institutions so that they could actually be able to develop the systems and also the technology for manufacturing, so that you don't start manufacturing the day you get this kind of infection. It's the same thing we are seeing with vaccines. Now, the countries that are ahead of the others were testing similar vaccines before for 10, 20 years, and now within a few months they were able to create one that matches COVID-19 because they had the technology, the experience, and the resources for a long time to do that.
Are we going to find a better opportunity than this one to actually do this very thing that we haven't done? Sure.
We have to start now. We have to start now.
Yes.
It may not, the manufacturing may not happen with this current, or at least not today or this year. But if we start now, it gives us a good opportunity to keep going after, like we've seen with the Buy Kenya, Build Kenya initiative, which I truly like.
Are there signs that we might be starting anytime soon?
I haven't seen that, to be truthful. I think we have the funding of universities. We have seen how many scientists, after a while, prefer to take flight rather than to fight because of the current systemic challenges. But one of the things I like is that our laws today commit 2% of our GDP to research. We haven't seen that allocated yet, but if we can start there, we should be able to see a better funding for the sector. And it's not just in health, it's across many other challenges that we face today in agriculture, in the environment, and what have you.
I like your optimism.
But
Yes, I am. I think I'm an eternal optimist.
over the last 7 months, if you observe the government's effort at improving our testing capacity, would you say that
Yes.
you've noticed any improvement in that? From the first
Yes, I
time
have.
when we know the number of tests that we were conducting to up to now, have we improved?
Yes, a lot of improvement, because the kind of testing being done today was not done before. There has been a lot of assignment and recruitment of staff to do this testing in different labs. There's also been reappropriation of different machines or equipment that were used for other infections. And this is a good thing, because these machines would not just be used for one condition, say HIV, or and now they are being used for COVID. And we have also seen that labs across the country coming up to help, not just within Nairobi. So I think we were not where we were. We are far ahead of where we were in February, and that's a good thing. It's been a wake-up call also for many institutions and also for the ministry. I hope we keep growing that so that we do not lose the advancement that we've seen.
So are you saying that you've also seen improvement in our procurement for testing kits and the reagents?
I think that's one big issue with the government entities, that procurement, in as much as it needs to be regulated, sometimes it's also too bureaucratic. So it could take you weeks or months before you can actually bring in import any materials, because of the process you need to take. And this is done to protect corruption, but in essence, it really doesn't appear to do so. So I think it's one of the areas that we need to use technology to change, so that we have more efficient and more accountable systems.
This is Kenya's biggest conversation, The Situation Room. We are speaking with Dr. Moses Masika. He is a virologist at the University of Nairobi. He's a man who's been tracking the spread of COVID-19 in the country and telling us what's happening. And also, he's saying that what we are seeing now is indications of a second wave of the virus. And, you know, the questions that, of course, will continue emerging is, what is this second wave? What is causing this second wave? Are the numbers that we are seeing a reflection of really everything that's happening on the ground, or some of these numbers also creating confusion by themselves? Listen, every morning we have in the room C.T. Muga, Nduoko, and Eric Latif. Joining us this hour is Dr. Moses Masika, virologist at the University of Nairobi, tracking the spread of COVID-19 in the country. And Dr. You're saying that this clearly are signs of a second wave that's right here with us. If you look at those figures, in 1 month, month on month, and the drop or rise of the positivity rate. So by the time the president was relaxing some of the measures and even extending curfew, but reducing the number of hours for curfew on the 28th of September, the announcement was that the positivity rate was around 4.3%. The previous month, it had been 7%. Month before that, it had been at 9 and then 12. And then immediately now, from September to the 21st, we are back to 12%. Those are serious, spikes and drops. Is this a reality, or are these figures just, shifting a bit too fast and too high?
This is the reality, Eric. And if you remember, when we were actually serious about fighting COVID, many Kenyans were complaining that things were very tough. Right now, things are back to normal. In the health facilities, healthcare workers are seeing now more cases. Initially, these have dropped. Initially, it was very high and then it dropped. And now we are taking care of more people who are sick, and an increasing number that is very sick or severely sick. So this, I think, is the real picture. And we need to come to terms with that we are now riding the second wave. It is not, as many people would like to believe, the government cooking numbers. This is sadly the picture that we have to contend with and deal with it.
Is it possible that this was the reality even 28 days ago when the president was making this announcement, only that maybe the government acted too fast? Because what I'm trying to understand is, what is it that has happened in 24 days that then creates such a huge shift that you can see people going to hospital? What in terms of even people's lifestyles has changed between mid-September and mid-October?
To start with your last question, we've seen a lot of people now doing away with their masks. We've seen more gatherings. You've seen a lot of meetings by politicians, and even Kenyans are now having more family meetings. A baby was born in April. They never got to see. They now have an opportunity to go and see that baby. We have a lot of basically life really going back to pre-COVID-19 times, because it is I think the attitude or the view that COVID is no longer a threat that has affected this. One good thing that I can confirm is that by the time the president was relaxing some of the measures, the hospitals were really nearly empty of serious COVID-19 cases. Now they are filling up again. So it's not like these cases had gone to hide somewhere else. It means we really had fewer cases than we do now. And the explanation from where I sit is that we have not just relaxed the measures that the president announced, we really took it as if there is no more COVID. Let us go back to our normal lives. And you can see this, Eric, if you tour around the city and also outside the city. You will see very few people with masks. You will see a lot of gatherings. You will hear about them. And you can see our politicians have been at the forefront ensuring that we gather and meet together.
Right. A petri dish of disaster as such.
Yes.
But now if you look at the realities that people face and they said, okay, well, we needed to get back into things, how do you reverse this? How do you get people back into that state of mind to say, okay, we actually need to be careful about this? I mean, looking at it, looking at it medically is what you would do. Looking at the science of it is what you would do, Dr. Masika. But then taking that science and then extrapolating it to a community of people who wants to go back into the social practice. How do you do that and say, these are the facts and the figures, which you've just told us a few minutes ago? This is the fact. This is the reality. This is what the science is showing us. How do we then apply this to the mentality of people who have said that COVID is we're done with it?
I think there are two things. One is posturing, and the second is enforcement. I think as it is now, a lot of leadership has taken the posture of COVID is over. And this message percolates, or it goes down to the masses and everybody else who should be following the measures that we need to follow. And if that posturing doesn't change, we are not going to see whatever scientific messages we put across. We may not see much change. The other bit is about enforcement. I think there has been a relaxation of the enforcement of the COVID-19 measures, and this needs to be done so that people actually recognize that we are still fighting COVID. We still need to follow certain regulations and certain measures so as to protect ourselves and to protect others. As I said before, having the kind of meetings that we had yesterday is not really a true sign of patriotism, if you ask me. The true sign of patriotism right now is to stay at home if you can and keep social distancing.
What about children going back to school? Because we go back to when the virus made its debut in this country, and the first institution across the country to be closed was schools. All children until the university level were asked to go home. What about the opening of schools now?
But before Dr. Masika answers, let me add on to it. Examples right around the world have shown us that the one thing that happened with certainty is schools were opened and then closed again. So does it make sense that we had to open these schools?
I think for now, the schools just opened. They didn't drive the current wave. And they've opened only a few classes. These few classes, I believe, if teachers are serious, they can be spread across the current rooms, and they will fit nicely with social distancing. The teachers would be enough because they're only teaching a few classes to teach this. For most places, of course, I know there are schools where that doesn't apply because there are no classrooms and no teachers.
Right.
But I think we cannot blame schools yet. I wouldn't rush to open the rest of the classes, though, because of the current situation. But I don't think we need to close them up as they are now, because I think it gives us an opportunity to fix what needs to be fixed in the schools. The teachers there with students can see where they need a hand washing installation, or how much water they need for this number of students. These are things that can be done practically now that a few of the students are in school.
Sure, but then we've
I
seen
would
some
not rush.
cases positive in some schools already, as reported today. At least 2 cases having been found positive in schools today.
Yes, but you remember these kids are also coming from the society that has many more positives. So for me, I would say we cannot yet blame schools for that. They of course, they are a risky place because once it gets into a school, it's very easy to spread. But we should withhold reopening the rest of the reopening the rest of the classes. And of course, if the situation push comes to shove, it could mean closure of the schools again. I'm hoping we don't start going towards that direction of clawing back on some of the measures, because some of the measures that were relaxed, such as the lockdown and what have you, because then it means you've really lost the battle at that point. We could, I think, if we enforce the current measures, be able to get the second wave control so that it doesn't get out of control. Sorry.
If you look at what has been happening, even in the last couple of months, the president making his announcement on what measures to retain, what measures to relax, or what measures to add. At some point, he said there is a competition between two rights. There's pressure to reopen the economy and growing pressure to reopen, and there's still growing pressure to retain things as they were so that you can contain the spread of this virus. It appears that at some point, the pressure for the reopening of the economy, the livelihood side, appears to have taken more weight as opposed to the lives side.
Yes.
From your interactions with the fellow virologists and those people who work in the healthcare system, and even those that work in the Ministry of Health, do you sense some sense of frustration that these measures have been relaxed?
For now, I think we can't really blame the relaxation of the measures completely, because not all of them were relaxed. For me, I think the biggest issue is where we do not effect what the measures that are currently in place. I wouldn't advocate for going back to a lockdown and closure of businesses right now, but I would advocate for better enforcement. That what guidelines these businesses were given, what guidelines we are given as the general public ought to be followed. And if that is done and it stays, then we can reverse and go back to where we were. As you say, livelihoods are important, and if you do not protect them, then even the lives will be difficult to protect. So I would say it is a very tricky balance to maintain. And what we are doing wrong right now is not just is not mainly the relaxation of measures that were done back then by the president. It is a lack of enforcement and following of what we need to be following now.
But Atari, does it not sound or seem as though we are now experimenting with people's lives?
Well, I think most countries have been experimenting, unfortunately, because this is an unprecedented attack on humanity. And for many countries, many countries have had to try different things and see what works for them. I see as a country we have done quite well, actually, so far, except now that we seem to be having an unexpected rise. And I think if we put our minds to it, we could ride this. So I think in as much as it sounds unpalatable, in a way, some of the measures we took as hoping that they will work. There was no guarantee. Many of them worked, some didn't, and we hope that we keep making the right decision.
If you look at the response now across the counties, it's basically just counties being expected to implement what they should have put in place in terms of preparations. If you look at MTRH or Wasingishu, Nakuru, and all the other counties, they were expected to have X number of beds. They were expected to improve their ICU capacity. They're expected to have improved how they get their oxygen. So are we at a point where we really should be worried, or are we at a point where we should just be looking at the counties and saying, this is your capacity, can you work on improving your capacity at present?
I think we actually need to have that conversation much more deeply with you may have lost my video, but that's okay, with each county to make sure that they are ready, because I think there may be beds, there may have been capacity that was actually in schools and that now is no longer available. There may have been hospitals that have beds that we don't know how many people can handle so far. We need to do that conversation continuously so that counties don't come to a point and think that the COVID is over and we can now start doing away with the facilities that we had set aside for COVID. I think if we manage to control the numbers like we saw in Nairobi and Mombasa, we came to even at the peak, we were still able to handle the number of sick patients. And that's what we'd like to see in the counties. So that if there are patients in a given county that too many, even a neighboring county should be able to absorb them. But if there is no capacity at all, then it becomes a challenge to deal with this issue.
I know that you had said previously, Dr. that we will not necessarily have to get huge numbers of reports from massive testing. And what you see presenting in hospital could be an indication then of what is happening in the country. However, some of the decisions that are then made at a national level, at policy level, whether it is coming from the executive or coming from the Ministry of Health, is based on this data, or should be, in my opinion, based on this data. How then will you be able to make decisions about what should be done in the future if we don't have adequate information or adequate data that is feeding or fueling that?
Do I agree with you that we could do better, as I said, with the testing, and especially in terms of targeting more people who may be exposed and also at risk? That needs to continue, and that effort should not stop. But also the data we are getting from the thousands that are being tested every day has been very useful. If we were not testing at all, then we would be really swimming in the dark. That is what worries me with some countries. So if you have 1,000, 2,000, 3,000, 5,000, 6,000 people being tested every day, you're better off than not testing at all, even though we could still keep improving that testing. So my point is that we should not stop the push to test more, but we can actually still use the data that we're generating so far.
I agree with you, but in your opinion, what would be the ideal numbers we should be testing given our population? If there is any such thing as an ideal number.
Yes, for me, it's not about the ideal number. It's about tracking and tracing as many people as possible. It becomes nearly impossible when the transmission right now is in the community stage, where transmission is occurring left, right, and center. But we should make that attempt, that every time you make a diagnosis, you track and trace every contact you can for that person. And of course, if you do that, then the numbers that require testing will increase. I think that's the best we can do now. We should also have enough to test people who are in hospital with certain symptoms, any symptoms of respiratory illness, and also patients who come to hospital with underlying conditions that would predispose them to severe disease if they got COVID, as well as the frontline healthcare workers, frontline security forces, and what have you. So it needs to be targeted, yes. And you cannot give a specific number because this number will keep varying depending on the levels of infection. But if we can test as many people who have through contact tracing, test as many people who are coming to hospital with symptoms, test as many people with underlying conditions who are in hospitals, and also test the frontline healthcare workers, then we should be all right.
All right. If the numbers overwhelm our health system because it appears that we're heading in that direction, what is the worst case scenario?
Well, I do not want to imagine what could happen if that was the case.
I'm afraid we must imagine it, because it's in imagining what could happen that we put the measures in place in the first place.
Yes. The truth is that if we were to stop the measures that we have now and the cases continue increasing, what would happen is that even people who require to be hospitalized will not have the space or the resources that they need at a hospital. So you may not have a bed, you may not have oxygen. And what this means is that instead of having the 2% death rates that we are seeing, this could even double or go much higher because we will have more deaths than we should. That really is the bottom line, that we need to make sure that the numbers, and this is what we've kept talking about when we're saying we need to flatten the curve, that the numbers of the sick need to be maintained as low as possible so that our hospitals are able to take care of those who need care. And if that is taken away, then we'll end up having people who need care not getting the right care, and then we have more deaths than we should.
What conditions need to be arrived at or maintained for, as a 5-year-old said a few days ago, for COVID to go away? What, if you're looking at it from the science of it, what needs to happen for essentially this virus to go away?
I think one is to keep the numbers low so that we do not keep the virus in high circulation. But then one of the things that really help is a vaccine that can be given to most people, and especially those who are at risk and those who are in the front line, to make sure that we reduce the transmission. So first of all, we have to take the measures that we have taken and take them more seriously. And then additionally, we need a vaccine that could help us wipe or reduce the transmission. And even then, we may not see a complete eradication of COVID-19 from the globe. It may just reduce to a level where it's no longer such a big worry. And I say that because with so many people infected in the community, it's unlikely that we are going to eliminate it completely. It is likely to continue circulating in low numbers, even if we give people vaccines, because there are those who may not get the vaccine, and there are those, it is likely that even if we get a vaccine, it may not be 100% effective. So there are still those who may get infected. So it will take a combination of measures, both the ones that we are taking now and also scientific solutions to this issue, so that we can say we now can go back to near normal lives.
As you said, we keep experimenting, so some experiments will work, those will be maintained, others may not work, and therefore they may call for change of strategy. Initially, with this response to COVID-19, there was a strategy that was called test, trace, isolate. Is that still in place? Are we still tracing, contact tracing, and isolating people who've been traced?
I think, yes, that should still be in place. How effectively it's being done is a question. But isolation has changed in a sense, because before we were isolating people in facilities, now people are isolated at home, which is also good because it's cheaper and it also makes it easier for the persons who are sick, although it may put a few people at risk in the family. So that strategy still needs to continue, but now with the recognition that this is at a stage we call community transmission, where many more people are infected, so we may not reach everybody because we are only testing those who have contacts or those who have symptoms. And for that reason, we still need to assume that people who are not tested or have not been identified could be positive. So the strategy is maintained, but the environment in which it's being implemented has changed.
The other strategy was, of course, working with the health facilities and looking at their capacity and boosting their capacity. When we see the chief executive officer of the Moi Teaching and Referral Hospital talking about Yesterday alone, they had 36 patients in isolation, 70 placed under home-based care. And
Yes.
this number already causing concern for a facility such as this one. This is, I believe, the second or third largest hospital in the country. When 36 patients in a day causes concern for such a huge facility, what does that say about the level of preparedness or even the capacity of our healthcare system?
I think when you look at especially high-level care, ICU and what have you, we do not have a very big capacity across the country. In fact, when we were starting this, there were only about 400 beds. So when you get 36 for a hospital that didn't have that capacity to begin with, it's a challenge. And this occurs, I mean, if this were 36 patients in a month, it would be okay. But if it's in a day, then the kind of staffing you need, the kind of resources you need to handle such a number, if you are not handling it before, could be challenged. But it also tells us that no hospital is immune to being flooded or being overrun. Including the largest hospital in the country, Kenyatta National Hospital, it can be overwhelmed if the numbers are high. And that's why we keep saying, what can we do to improve our hospital capacities, and also as we improve that, to keep the numbers manageable. Because in as much as we keep our hospitals expanding and giving them more beds and more resources and more facilities, they are not enough, and they'll never be enough to admit all Kenyans if we all got sick.
Should we not be seeing then some concerted response from the national government and the county government? Nakuru has been having a rising number of cases over the last couple of weeks, getting to a point where the governor himself is coming out to say, look, this is what's happening, and it's a point of concern for us. But we don't see the national government taking that kind of response. So the Council of Governors saying, this is what we are seeing in Nakuru. This is how we can go in and help Nakuru expand its capacity as we work then into seeing what other areas require support. Is this a breakdown, or is this, lack of commitment, so to speak, from the political leadership?
I may not be privy to what the national government is doing with these specific counties, but I think the counties would be left alone. It will take collaboration with the national government for resources, and collaboration with neighboring counties to sometimes distribute the workload where need be. So there's no way we can leave this to the counties alone. I have a feeling the national government has been doing something. I don't know if they have relaxed over the last few weeks, but they have tried to equip the counties. But I think even though health is a devolved function that counties need to handle, the national government needs to support them very strongly so that every place that we have trouble is supported sufficiently or supported with enough resources to overcome that. Because if Nakuru is overrun, then the surrounding counties, including those that are nearby, even Nairobi, would feel the pinch, and eventually the rest of the country. So it's not just one county struggling alone. It needs to be collaborating with the national government and also neighboring counties, because some of the neighboring counties may have capacity that is not used up, and that could help.
Even as we talk about these details, the truth of the matter is people generally don't want to believe that COVID exists. And
sadly.
Yes, and so long as that is the issue, or as long as that is the talking point, will all these efforts we're trying to make really bear the fruit we expect it to bear?
You're right, City. If we don't, as I said, change our attitude, change our posturing, we are fighting a losing battle. Because, and even today, I get people ask me, Masika, is this thing real, or are we being taken for a ride? And it's a very frustrating question, but I take the time to explain because I know where this person is coming from. The distrust in government and what have you is deep-seated in many of us. So we have to see how to convince as many Kenyans as possible that they need to come on board and take this seriously. Otherwise, we are fighting a losing battle because they will continue to expose themselves and expose others without a care.
Right.
Daktari, final message
Yes.
to Kenyans, bearing in mind the reality that I've got to get out, I've got to go and earn a living, I've got to see if I can take my children out to play and take my child to school. What would you advise us to do?
For me, I would say that COVID-19 is still here. We need to protect ourselves and we need to protect others around us. It luckily doesn't take a lot of or costly measures to protect ourselves. We avoid exposing ourselves to groups of people. If you have to leave the house, then wear a mask. And before you engage in any activity, ask yourself if it's worth it, if it's worth getting COVID, especially with the meetings we are seeing and what have you, so that we do not expose ourselves unnecessarily and we do not expose others. So the final message is that COVID-19 is still here. We still need to tighten our belts and keep taking the precautions that we've been taking to protect ourselves and protect others.
Asante sana. Thank you very much for speaking to us today, Dr. Moses Masika, virologist at the University of Nairobi. We hope to get in touch with you again in coming days. Hopefully
Thank you for having
the
me.
situation will have improved.
I hope so too, and thanks for having me. It's always a pleasure interacting with you three.
Thank you so much, Dr.
Good job.
Asante sana.
Thank you.